Good morning, everyone, and welcome to this Kaleidoscope webinar on a bit of a grey day in southeast London. I hope it's slightly sunnier wherever you are. Well, I think we're going to have a really fascinating hour ahead talking about curiosity. So thank you very much for joining. My name is Richard Taunt.
I'm Kate Chima.
And I'm Anna Howells.
And we're going to spend the next hour talking about a range of facets to do with curiosity. And really pleased to have you joining us. Just to very quickly, just to remind people who we are to begin with. So Kaleidoscope, we're a social enterprise focused on bringing people together to improve health and care. Lots more about exactly what we do at kaleidoscope.healthcare if you want to go and read up on the sort of things we do. But today we're talking about Curiosity Club, which we're calling it sort of this pioneering new learning network to realise the benefits of curiosity for individuals and organisations. To the best of our knowledge, Kate, there isn't another learning network ever in the world focused on curiosity.
If there is, we haven't found it yet.
Right. Okay. Good. So we are trying to do something really quite different here, and so it's wonderful to be joined by other people who are similarly curious in these concepts as we are. If actually you're expecting to dial into something not about curiosity, you've got two options. Either you can just leave now, or you might be so curious about what we're going to discuss that you want to stay with us. We hope very much it's the latter. Just some quick housekeeping about how to get involved today. So we hope we're really interactive next 57 minutes. We'd love you to join in. We're not going to take sort of contributions by voice over the line today, just because of the number of people we've got and the best way on this. So we'd ask you just to ask questions and put in comments just by text, and you can do that in three ways. You can either use the Ask Question feature on GoToMeeting, where you just type in your thing and we will receive that here, number one. Second, if you can't find the question button, and occasionally it looks a bit different on different systems, occasionally it looks a bit like a sort of sideways hairdryer, have a look to see if you can see that. Do just email us, admin@Kaleidoscope.Healthcare, and Anna, you're picking those up?
Indeed, yeah.
Excellent. And finally, if you're on Twitter and you want to tweet, please do #curiosity or Twitter #Health. We are recording today, so if suddenly your connection goes down in the middle of it all, don't worry, don't panic. You will be able to watch back later on. Have I missed that?
I don't think so. I think that covers it.
Excellent. I think if you've got questions about how to interact, just pop it in on the question. Do send us an email. It'd be great to have you involved throughout. So, what we're actually going to cover today?
We have two sessions for you today. Firstly, welcome on the line Dr. Adrian from Windsor, Ascot and Maidenhead CCG, and we're going to be talking to Adrian a little bit about how curiosity has made a difference to him in terms of his practice as a GP, but also from a leadership perspective, and then a little bit from me in terms of what Curiosity Club is going to look like, how you can engage with it, what you can expect to get out of the network, if you wanted to get involved with that over the next 12 months. So, Adrian, thank you. I'm absolutely delighted that you could join us. We've already had lots of interesting conversations about curiosity and what it has meant for you. Just for the rest of the people on the webinar, would you mind introducing yourself, giving a little bit of background?
Yeah, that's great. No, so thank you for inviting me to this webinar. So Adrian Hayter, I'm a GP, and I'm actually sitting at my desk in my GP surgery, which is in Old Windsor, about a mile out of Windsor town centre. So and it's equally bleak and grey looking out of my window, but a bit warm and hot because the NHS doesn't extend to air conditioning. Really, I've been sat in this seat for the last 20 years, 24 years as a GP. I came and trained at this practice here, and I'm part of the community here in Old Windsor, and really enjoy my work here with patients, with the community of Old Windsor, and Englefield Green, which is the village next to us. So that's really where I work, and my training as a GP followed the normal course of kind of training, and coming out and working in hospitals for a few years, and then coming into the practice and being a vocational kind of experience around training, kind of learning with other people, experiential learning, which is great actually. And the way that we are education in vocational training in general practice in this country leads the world really in kind of how we support GPs in training. So benefited from that, and been really interested in communities and supporting communities, and really the vision of primary care as the World Health Organization set it out in terms of being the first point of contact with people, supporting people's health and well-being, and being able to improve outcomes for people and populations. So that's really kind of my passion. And then over the years have gone on to work with not only the population here in Old Windsor, but working in the population locally in Windsor, Ascot and Maidenhead, and looking at how we collaborate with other areas as well to work better together to improve across health and social care the outcomes for people and individuals in the area. So that's really where my background is. Leadership roles, I've taken on leadership roles over the years and worked in primary care groups, if people remember those kind of things, and primary care trusts, and then more recently helped set up the Windsor, Ascot and Maidenhead Clinical Commissioning Group, which is commissioning healthcare. That was in 2012, and since 2013 have kind of led the governing body of Windsor, Ascot and Maidenhead. So we're in charge of a budget of £150 million, and making sure that money is spent really wisely for taxpayers, but also really working hard to kind of improve and get good working relationships with our local authority, the Royal Borough of Windsor Maidenhead. And just finally, kind of over the last couple of years, been working with a national organisation called NHSCC, national. That's kind of the clinical commissioning national body, and their South Central representation. So working on a few national agendas to be able to support people, and then within the Frimley Health and Care system, which is the system that I'm in, we're really working to get some support the leadership development across our sustainability and transformation partnership. So we've got a really great cohort of 27 people across health and social care who are part of the Frimley STP 2020 programme. So I'm part of the programme board for that, and we're working with an organisation called Co-Create to be able to support those people in really working collaboratively to bring out and improve health outcomes. So that's my quick resume. Sorry if I've gone on too long, but
that's quite a resume, Adrian, and I have absolutely no doubt that throughout all of that, curiosity has played a significant part. But perhaps we can think about, just initially thinking about that chair you've been in for 20 years, how do you think curiosity has impacted and potentially improved in terms of your practice as a GP?
I think it's fundamental, and so this is where my passion and my attraction to the work that you're doing in Kaleidoscope is really important, and I think as individuals and organisations we don't pay enough attention and enough time to it, and if you like, I'm feeling now in the kind of in the next maybe 10-20 years of my career, one of the things that is really important is to engender kind of curiosity into people and organisations, and that's really why I have a passion to get involved in some of the supporting leadership activities that I'm being involved in. So I think, so I got this kind of impression now, is kind of curiosity kind of something which is inborn? Is it something which is nature, or is it something which is nurture? So, and I've asked that question to myself a few times. My granddad actually he was an intensely curious person. He worked in Burma, and he was an electrician, and he set up the the electricity system in Burma. So he was kind of he used his technology skills to push the boundaries and to work in a different kind of way. So is it because of that, or is it something that we have to nurture? And I think it's a bit of both probably, but I think we can do a lot, especially kind of from childhood, to be able to kind of nurture the skills of curiosity in people. What I've found and actually observed in this seat here is that there are opportunities that you can give people to actually support their curiosity, and those important opportunities can't be missed. So, you know, with a training practice here, giving people the opportunities to be curious is really important, and to be able to explore. If you dampen that down, what I think is, especially people at the beginning of their careers, can actually then lose it. And we know that, you know, the first 5 years of becoming a consultant or becoming a GP are really important years to be able to nurture curiosity and nurture the abilities to go in to do things and think about things in different ways. If it's not done in those years, people may have a lifetime of lacking curiosity, which I think is a real shame. And so that's really one of the things that I've kind of noticed over the last kind of 20 years or so. The other thing is, a new skill for me in the last few years has been to chair this governing body of Windsor, Ascot and Maidenhead. So actually, if you apply the skills to the groups that you lead, so in my governing body, we've got a collection of people who are joined together to think about the system of Windsor, Ascot and Maidenhead. And those may be, we've got a secondary care consultant, we've got lay members, we've got nurses, we've got doctors, we've got an executive team, we've got a whole range of different people. And what I've tried to do is to engender curiosity in that group. And actually by allowing that and feeding that, it's made our governing body a live governing body, a body that's not afraid to question, is not afraid to kind of ask intriguing questions. And actually that adds really to our effectiveness. So you can apply curiosity to your workplace. You can apply curiosity to the roles and responsibilities that you have. So those are the things that I've noticed really in terms of curiosity for the working kind of roles that I've had over the years.
So building on that idea of engendering curiosity, what thoughts do you have in terms of how we can build on that and build curiosity in other people? So you've mentioned your involvement in the Frimley 2020 programme. How are leaders being developed to engender curiosity in their staff, do you think, or is that not something that we currently give enough airtime to?
Yeah, so this is one of the things that, you know, so we've set about. So it's myself and Peter Bibaway, who's kind of the medical director of North East Hampshire and Farnham, who kind of we had similar ideas around kind of leadership development, and we sat and actually, you know, the coming together of those ideas has then kind of over the last year started to kind of get a cohort of 27 people. So we've given a lot of thought to it. The first thing, which is really important, I think, is actually to give people some protected time, you know, to actually allow yourselves the time to be able to be curious, because we're very busy, and I could be very busy all day long doing things in a particular kind of way. And actually, unless we give ourselves the time and the space to kind of start to think about things in a different, and it doesn't have to be necessarily just in work time, but it's, you know, it's around how you organize your life, but actually in the work time, in that space, you need to have some time to think and do things differently, and that's what quality improvement is about, really. We did a program which was before this 2020, which I led in Windsor with a smaller cohort of people across health and social care. One of the GPs in the cohort was a little bit before she joined the program was really she'd been in a practice for 5 years as a salaried doctor. And she had just been coming into work, doing her job and going home. And she felt disempowered to make any changes. And she was worried, she was curious about what the program meant. And I spent a little bit of time with her before she entered the program to just, understand her fears and concerns. And I said, well, I can understand those concerns. Give it a try. Just protect your time. And we supported her with the practice in protecting the time. She came out after 9 months of the program, having done a quality improvement program. And she said it was one of the biggest revelations to her. She'd actually been empowered. And what she said was, in her exit kind of feedback, was that we can all be leaders. We can all make changes to improve. And she did a small quality improvement program in the surgery which benefited patients. And she said she never felt that she was she would be able to do those kind of things. But giving some time and space over those 9 months to learning set activities allowed her to then take that next step. And now she's got it for life. And she had real ideas of what she wanted to do. She wanted to do some work in education and other things. So I really think it's important that space and time and protecting, and organisations have a role in that, individuals have a role in that, and support organisations. And this is really why Curiosity Club is such a great idea, because actually there's the support for organisations and individuals to be able to get that time to affect real leaders in whatever organisation you work in.
Did you want to ask a question?
Well, can I jump in? I'm curious, Kate. Adrian, thanks so much. I think this is really interesting. Just to say to attendees, if this is sparking lots of ideas, thoughts, questions, do contribute through the text or email. It'd be great to hear from you. Adrian, I just wanted to pick up on your point about that protected time, and it is the constant battle. Certainly, when I talk to people across the NHS about how you find headspace for the things you feel you probably should be doing, but you struggle to, given all of the pressures which we're also aware of. What advice would you give to others, Adrian, about getting that balance right between sort of coping with the firefighting and then carving out that time and making the case for why a focus on curiosity for an hour is going to get you more benefit than trying to battle your inbox, for example?
I think it's about teamwork. If you are an organisation that values teamwork, you will create the time within your team to do that. So it's really fantastic that I work within a great team here at Runnymede Medical Practice, which is, a team of partners and doctors and nurses who allow me the time to do some of the stuff, and I allow them the time as well to do things. And we've got GPs who are educationalists, and they're involved in training, and we've got other people who are involved in quality initiatives. We've got GPs who are involved in kind of supporting dementia care and social prescribing. So we allow each other some space and time to be able to do it, and so that's a good function of a team. I used to work with an organisation. It's a large American organisation which had really good occupational health department, and actually we worked with pressure and stress in their organisation. I was part of their occupational health team. We worked with kind of pressure and stress, and this was an organisation which had a lot of young people under a lot of pressure and stress. And actually, we started to work not with individuals but with teams, and actually to say to them, how do you work more effectively as a team? And there's a really good evidence base, so you can look at the evidence for investing in your team to be able to reduce down sickness absence records, make your team more effective. So there's a business case which actually you can apply, and I think you'd be able to apply that to curiosity as well as kind of instead of the negative thing around stress, this is a very positive thing. And I think most organisations, you could create a business case for positive curiosity. And the big organisations, Google and other big organisations, they get it, and they've got it, and they've got it built into some of their philosophy and their values. So I think investing the time in it, thinking about it, is a really important an important structure to build into your organisation.
Okay, fantastic. Thanks, Richard. Thank you for jumping in. Adrian, I'm acutely aware that I know you've got to disappear at past.
Yeah,
so...
I'm not too bothered. I've just got a little. I've had a little bit of a fortunate thing, so I'm not going to have to escape completely at past. So
fantastic. So we've got you for even longer. That's brilliant. Do you, building on the concept of teams and the importance of the team in developing curious behaviours, how do you think we can encourage those behaviours in the next generation of clinicians, in the next generation of leaders, so that we move towards that? Google, other organisations are available with approach of having curiosity as a core value within an organisation, and critically teams that deliver care.
So I think it has to kind of stem from leadership skills and abilities, and I think that goes right to the top. I'd encourage Simon Stevens and the board at NHS England to be kind of to challenge themselves around curiosity. So I think it goes right to the top. But we've also got this great opportunity, which I think is, around health and social care. So this is just not just about kind of, a health focus, because, if we really want to change how things are, we want to, this is the collaborative work between health and social care. So I would say, kind of use the opportunity in the joining up of health and care to be, to reset your vision and your values around the staff that are working there. And that's really what the 2020 programme is doing. It's saying to health and social care, each of the organisations, so whether it's Frimley Health, the Foundation Trust, whether it's the individual clinical commissioning groups, the 5 clinical commissioning groups, whether it's the community trust, are signed up to saying to their people, this is the right thing to do. We want to send you to be able to have the time and the space to think about collaborative leadership in the work that you do. And this is not at the kind of the very sky high, the kind of the systems level. It's actually at the meso level, the level of where people are doing things and working with their consultants, GPs. They're doing the work and actually introducing those ideas to them. So there's 3 things that we're doing. Is joining organisations up to have that collective vision, senior leadership signing up to that collective vision to allow their leaders to go away and to have the space, and thinking about investing in people, so investing in each of those individual 27 people on the Frimley 2020 cohort, thinking about the place, so the place is where we're all working. I'm working here in Old Windsor, and people will be having different places that they're working, and thinking about our focus on population health. So those 3 Ps, together with the right leadership at a system level, with all the organisations, whether you're in a local authority or whether you work for an NHS organisation, whether that's a provider or a commissioning organisation, it probably will change in the future to something else. So wherever you're working, these are skills for the future.
Yeah, fabulous. Adrian, thank you so much for joining us. I found that a fascinating insight into how practically curiosity can make a difference at all levels of the system, from the absolute front line of patient care right the way through to systems, and obviously looking towards our future in terms of STPs and integrated organisations. So great. Thank you very much. Do stay on the line, and if you want to chip in at any point, do let us know.
Yeah, I will. I'm just going to check on my diary. I think I've got a patient who's going to be waiting. So I'll sign off now, and good to speak to you.
Lovely. Thanks very much, Adrian.
Bye-bye.
Hope that everybody found that incredibly valuable, that I did. Adrian's view, is absolutely from the front line. It's fantastic that, again, he's got that breadth of experience, and curiosity is valuable over the entire spectrum. What we'd like to do now is just give you a brief overview of Curiosity Club, what that is going to look like. It's incredibly exciting. I'm very excited. You're excited?
We're excited.
We're excited, and I hope that you're going to be excited too. So Curiosity Club is, you'll see here our
Can we have a quiz, Kate?
Okay, does anybody know what that is?
This is your chance to quickly type in if you know what this image is.
What is the image? This is our mascot.
This our adopted mascot.
Adopted
Will they
mascot.
give it to us? That'd be quite fun.
Well, the pictures are open source.
Oh, okay.
So maybe.
Yeah, okay. All right, we can take the picture if not the thing. We haven't been deluged by responses.
We haven't been deluged by responses.
No,
Should
no.
I just? No.
Go on.
Should I tell them? This is the Curiosity rover, which is currently pootling around the surface of Mars, sending back fabulous images of the place where, in a couple of generations, no doubt, Elon Musk would have set up a habitat for human beings, and is really it is the flagship of Curiosity as a fantastic and pretty unique human endeavour, human trait, if you like. Reaching out to new things. Really trying to not start to quote Star Trek and new civilizations, etc., etc. But we feel is really indicative of what Curiosity can achieve in the kind of scientific bent. And Curiosity Club really seeks to harness our natural curiosity. So you heard Adrian talking about curiosity as a natural instinct, and certainly any of you who have young children, and I mean this morning I was asked no fewer than 30 questions on the way just to school, will know that there's an innate curiosity about the world, about finding out about new things. We feel that sometimes we lose that as we move into adulthood, and certainly once we move into the world of work with strict hierarchies and processes and procedures, that again, reflecting on some of Adrian's points, that innate curiosity gets crushed, and not necessarily for the good. And we think that curiosity gets a bit of a raw deal in the world of work, and particularly in health and social care systems. So we want Curiosity Club to be a place not just for curious people, but for curious people who want to be more curious and want to share the benefits of that curiosity with their fellow co-workers, for the benefit of themselves as individuals, but also their organisations and the people that they serve.
Can I ask a question?
Yes, you can ask a question.
Who took this photo?
NASA did. The Curiosity rover has a small other thing that goes off
like
with
a
it. So
built-in
it's basically
device.
a selfie device.
Oh, there we go.
So it takes quite a lot of selfies, the Curiosity rover.
Okay, that's my curiosity quenched. Thank you.
There isn't a secret person up there taking pictures. I promise. So from conversations with a number of people, I say, oh, I'm really excited about this Curiosity Club concept. And they're going, it sounds a little bit wishy-washy and flim-flam. It doesn't sound like you're a hardcore numbers person. But actually, this is all backed up by a significant body of research in curiosity. There's been a fairly recent survey, albeit not within social care, health and social care, looking at a survey of 3,000 workers, where overwhelmingly you had numbers of people saying that curiosity is absolutely essential to discover new ideas, to drive innovation, to really help us kind of develop our intellectual capabilities and move into a culture of continuous learning. But the flip side of that is that very few of them felt that they were supported in being able to exhibit curious behaviours and identify themselves as curious people within the workplace. I'm not going to go through all of this infographic, but I think it summarises very nicely the evidence base that sits behind it. And really, curiosity is everywhere in our lives, not just in terms of work, and we've got lots of numbers in terms of how it impacts on recruitment and retention, but in terms of personal relationships as well. The ability to tolerate working in a complex, ever-changing, and occasionally very ambiguous environment, which I'm sure is something that all of you can relate to, and actually even makes us happier. Curiosity and being able to follow up on our interests and learn new things makes us happier, more positive people. And there's nothing. What else could you possibly ask from life than to be happy? So Curiosity Club in itself then is designed as a 12-month programme, combining the very best in talk content, action learning, real-world application, building on experiences from speakers from as broad a range as polar explorers through clinicians like Adrian, who we've listened to this morning, and people from education, the kind of people who bring curiosity to life, if you like, even if they don't realise they're doing it. The programme itself is built around Kaleidoscope's network framework, and that has 5 key themes within it. So first of all, it has a very clear purpose, which is explicitly linked to your day job, and has, of course, as every rigorous programme should, have data attached to it to show that actually being part of this network can make a difference. It will take you beyond boundaries. We want to really challenge you. This isn't about looking inwards only, and it's not just about agreeing with each other and having a marvellous time. This is about pushing your understanding, really challenging how. Excuse us with the fire alarm. So I'm going to go off in here.
It's fine.
Okay. It's going to push you and really challenge your view from a range of different perspectives, and we're going to do that through some of the very best events, face-to-face and digital, that you can find. I've already mentioned some of the speakers that we've got lined up to be part of this. At the same time, we understand that this is challenging stuff, and is going to involve some serious reflection and challenge between individuals who are involved as well. So we want it to feel safe and carve out some of that safe space and time for curiosity, as again that Adrian mentioned earlier. And then most critical, I think, this is about building a community, building a kind of self-sustaining network of curious people. Who understand how to make themselves more curious and engage others in curious behaviours. And in order for that to be really meaningful, it needs to be led from the community. So that's our absolute, that's incredibly important to us. It's not going to be a series of things that we think you should be doing. It's going to be a series of things that are useful for you. All of that underpinned by our absolute key ethos. This is a rigorous programme. Like I said, we've talked about data and evidence, but also incredibly creative. We want this to be a space that really grabs you and is something that you're looking forward to being involved with. And also, everybody has something to teach and everybody has something to learn. That links very much to our leadership from the community principle.
Can I jump in?
Of course you
just
can.
In terms of, and I'm sure many of you are coming at this from a perspective which certainly I started off when we were thinking about curiosity, and that's just how you try and get your hands around such a seemingly amorphous concept as curiosity. Okay, you've been talking about how Curiosity Club's going to have data attached. Measurement and curiosity seems to be unlikely bedfellows. Can you talk a bit more about how do you measure this stuff?
How do you measure this stuff? So there's a couple of strategies that we've got in the pipeline for measuring curiosity. The first one is around curiosity is actually a fairly well-defined psychological trait, which we found, and there's a lot of research that has that looks at measuring curious behaviours in the workplace and measuring curious behaviours in individuals, and we'll probably look at both of those, I think, as we go forward, because research has found that highly curious individuals in their personal life don't necessarily translate that into the workplace. So that's something we could explore through curiosity in any case. That strategy number one is largely around that measurement at an individual level. Strategy number two is looking at the impact that we get within organisations. So we would look at some of the key metrics that are linked to the research. So I've already mentioned recruitment and retention, for example, connections between individuals. More curious people tend to have more connections. So we'd use a mix of social network analysis and then some hardcore outcomes in terms of recruitment and retention in order to build a holistic picture from a measurement perspective, and obviously a lot of qualitative information as well to ensure we've got context and narrative as well.
So Kate, if you are after joining Curiosity Club as a bit of esoteric nonsense, is this the right thing for you?
No, it is not.
Okay, this is not pre-rehearsed, is it?
No, not at all. Yeah. No, this is not in esoteric nonsense. This is backed up by hard science, and we'll be able to evidence change as we move through the programme. I think it's really important to note, so we've pulled out from here, although we're talking a lot in terms of health and social care, because we're Kaleidoscope Health and Care, it's kind of clues in the name. This programme is really for everybody, because there was a recent piece of work that came out of the Health Foundation that said 10% of your of the variation in life expectancy is down, in this country anyway, is down to healthcare. The rest of it is down to things like housing and crime and education and this kind of stuff. So we're working in an interconnected, highly interdependent context. So this programme has been designed for everybody. It's deliberately diverse. So, and it comes back to some of that pushing you beyond your boundaries principle. We're not going to try and define the connections that are made through this programme. We want to bring people together who are, you know, within the same journey, have the same interests, and critically are curious to learn from each other. So we don't have any entry criteria. We just want to, all we expect really is a commitment to attend events and be curious and make those connections, and obviously share your learning as we move through the programme. So this is broadly what it looks like. It's built around 4 face-to-face events with virtual content in addition to those scheduled days. The events we'll look at, so we're going to start with what does curiosity mean to me, and this is really an inspirational event. We're looking at explorers, we're looking at people who are really passionate, who've had life-changing experiences on the basis of curiosity. So this is the space where, you know, penicillin was invented because Alexander Fleming looked at something and said, oh, that looks interesting, and followed up on it. So we're really, that first event is about kind of bringing that inspiration to bear, but at the same time establishing and agreeing what our core purpose is. And I'll be there in the corner with my spreadsheets, telling you about some of the measurement approaches that we'll have, and also agree some of our rules of engagement, some of our ways of working, and how the network is going to practically work in between. And then we've got 2 broad themes throughout the rest of the programme. Building curiosity in the individual, so how to increase your personal curiosity, your developing curious behaviours, how you ask better questions and things like that, really practical key tools and ideas. And then moving into the curious organisation, and I think that's a real challenge for us. Individuals who are highly curious, that's fantastic, but how do you then bring that to bear in teams? Adrian talked about how important that team approach to building curiosity is. How do you practically do that? How do you inspire curiosity in other people? And we've got some amazing speakers lined up for that from the world of education, because effectively that's what they see their job as. It's inspiring curiosity in children and young adults. Obviously, we are keen to celebrate. So our final event is a celebration event. We're looking for to collate and share our learning across the wider economy, not just in health and social care, but everybody who comes. So we've got a kind of conference style end event. Now the close down element is really important. Now we don't want to just kind of then say thanks for everybody and leave it open. So we're going to have quite a purposeful close down event where we pull that learning together, curate and collate some of our outputs, and really leave you with a sense of not a sense of finality, but a kind of sense that we've built on our experience, and we've met our purpose. We have achieved something. What have we achieved? And here are some resources going forward in terms of long-term sustainability of our learning. All of this supported by fabulous virtual content, of course, webinars such as this, so content, but also live problem solving. particularly keen to kind of for people to come with their learning and come with their problems and share those and do that in a kind of real-time way. Blogs, podcasts, and obviously the Curiosity Club will have its own Curious website, which would provide you as an alumnus with long-term access to materials. And if we ran this program again, you'd be able to access the resources and materials generated by future programs as well. The money bit. This is one of Kaleidoscope Health and Care collaboratively funded programs. So rather than the usual way of doing things, particularly in NHS procurement land, we're looking for funders to come together to say that they can fund the delivery of the programme and then themselves benefit from the group learning. So on that basis, we have a range of different options. We are looking for about 36 participants before we're able to run the programme. If you would want to register as an individual, that's £3,000 per person. Is that including or excluding VAT? Excluding VAT. If you were looking at an organisational application, that £8,000 buys you 3 places per organisation. Or equally, if you wanted to have a completely different approach and engage as a funder, then do get in touch with us and we'd be delighted to chat through your requirements. If you wanted to buy the whole thing, that's fine. If you wanted to buy several for the next 10 years, even better. But you can give us a shout and we can talk that through. Do you want to add anything else to that, Richard, in terms of how Collaboration Funder works?
Yeah, so this is a sort of a whole other area we're working on at Kaleidoscope about how you can co-fund projects across the NHS and have that underpinned by co-learning. So you might want to look at it, the specific website, collaborationfunder.org. But one of the elements we're using with this program is that the minimum number of people we need to get the program to run is 36. But we can have up to 60 people. So for every single person after that 35th, actually, so from the 36th to the 60th, what we're able to do, because we have sort of some fixed costs involved in this, is actually take a % off the price for everybody. And so actually if 60 people join, then it's 25% off the price for everybody to reflect that there are fixed costs and we want to fund this collaboratively. We're far more interested in making this work and covering our costs than making it some ludicrous money-making scheme.
So quite literally, the more, the merrier.
Yeah.
Excellent. Yeah. Thank you. So I hope that that's whet your appetite, both in terms of Adrian's discussion of how positive curiosity can be at an individual and organisational level, but also that now we have potentially the means through which we can actually start to develop some of that. And it's not just about chit-chat, flim-flam and esoteric tomfoolery. We are interested in making this a reality and genuinely building curious behaviours into the NHS and beyond. So now we're going to turn to you. How can curiosity help you in your organisation and help meet your challenges today and in the future? Do we have any?
Kate, thank you very much. Can I just, and I'm really sorry, can I jump in first? And then I think we've started to get questions coming through, so that's great. And please put them in either by email or by text. That'd be fantastic. But Kate, again, just for a point, return to this point about the practicality of curiosity. And again, I'm sure there are people on the line who are thinking, yeah, that's great. Is it going to help me with RTT? Or is it going to help me with trying to work out what on earth an ACS is? Can you give us a practical example, Kate, of an organisation which has actually taken curiosity to its heart and what it's actually done in a quite practical way to improve the curiosity of its individuals and its organisation more generally? So
one fabulous example, and someone on the call may have heard this yesterday, is Northampton General Hospital had the most disastrous, well, not the most, but a pretty disastrous CQC report back in 2013, I think it was actually. and decided, what can we do about this? How can we change and improve and then get turn all of those reds and ambers into greens? And the approach that they took was absolutely fascinating, because they came to the conclusion, or the board came to the conclusion, that really this is about something not do more, whip faster, etc., etc. It was about understanding how the organisation operates and really inculcating a culture of curiosity at all levels, right the way through. So rather than having a CEO bashing people over the head saying your RTT isn't good enough, they walked the floors, they talked to individuals, they were curious about, well, why did that happen? What do you think could work better over a whole range of challenges, and not just in individual specialties, but across the board. That was a great example of leading from example. So the leadership got out there, was talking to people and asking them lots of questions, some of which people would have assumed they knew the answers to, and encouraging those questioning behaviours, and always being curious, building a learning culture on the basis of curiosity across the board. Now, it's taken a number of years, but in 2017, our most recent CQC inspection was almost entirely across the board green. So tangible clinical and managerial improvements at all levels have happened, largely because of this culture of curiosity that they've built. Now, there's obviously, I'm really oversimplifying, but that's a very practical organisation-wide example of how curiosity has fundamentally changed the nature of working in that organisation. So their staff survey came back far more positive than it had been for many years, but also a great example of how curiosity improves patient care. They had a number of challenges along the way, but these are the kind of examples that we would explore in Curiosity Club. There are loads more. I can just keep talking. You haven't got that long.
We've got a limited time. Okay, thank you. And really goes back to Adrian's point earlier about that leadership role modelling.
Yeah.
Absolutely. If there are any NHS England board members on the line, I'm not presuming that there are. But that point about how actually you get this role model at chief exec at board level, that constant questioning. Sorry, Anna, I cut you off. Questions?
Yeah, so we have a question from John. How important is creativity in developing curiosity, and can developing your curiosity help your creativity?
Question.
That's an excellent question. So, my view, and believe it or not, even as an informatics professional, there is some creativity involved. I think that developing curiosity, I don't think you can be, certainly not in the creative industries, I don't think you can be creative without being curious. And at the very least, asking what can be better? How can I change that? Does that work for someone? Asking the question of someone else, does this work for you? If I give you an example from a fairly recent piece of work that we were looking at, we'd done some kind of bog standard analysis with lots of data-y things in neat little charts all in a row, but we were kind of curious, does that actually work? We think we know what that says. We think that imparts a message. Does it do that for anyone else? So so there you go. The initial question, the initial piece of curiosity is this going to work for somebody else? We put it in front of someone else, and they kind of said, well, not really, because they weren't able to necessarily look at it as a whole. So we completely rethought how we were going to do it and came up with a more creative way to do it, a more interactive way, which instantly pulled people in, and we were able to have those conversations. But that initial piece of curiosity was absolutely critical to developing the creative, or getting the creative juices flowing.
Great. So to build on that, and just to say again, please do be putting in questions as we go through. That'd be great. So to flip it, is curiosity just for creative types? And that's sort of we're in an interesting place where I'm sure again people are thinking, okay, well, who needs to be curious within an organisation to create a curious organisation? Does it need just be a few people who've got this as a specific responsibility, or is this just everyone's job? How do you get that balance right, Kate?
That's a really good question. I'm not quite sure. I mean, to my mind, I think curiosity is everybody's job. And So to your initial question, I don't think, I mean, I am not a naturally creative person. I didn't draw a lot at school and things like that. And certainly when you think through what, my career is based in statistical analysis, effectively, generally speaking, that's not viewed as particularly creative. However, curiosity has been crucial to ensuring that those bits of analysis actually make a difference in, for example, a quality improvement program. I think that it is, certainly when I'm developing teams within the world of informatics, it's something that I look for as a core value in absolutely everybody at every single level. And
we mentioned Google earlier on, and again, other organisations are available. It's not just Google, but Google has been quite public and talked other times about how they recruit people to Google, with curiosity being one of their one of the two traits they most look out for. They put it front and centre when they're recruiting. Anna, how are we doing? Questions?
Yeah, we've got one more question. So, sounds really interesting. Will there be any info we can use to build a business case for the spend to get involved?
Great, and I think that's come through from Ailey. Ailey, hello, hope you're well. Really, really important point, and comes back to how do you take an amorphous, nebulous, flim-flam topic and build that really strong business case? Kate.
I've already talked quite a lot about the evidence base that's there, and we will certainly, we've started to pull that together into, you've seen it in the infographic, and we're very happy to pull that together into something a little more, shall I say, business case appropriate. What we're also able to do, in the process of doing, is building up a few case studies. So Adrian is a great example of one of those, and being able to articulate how it's made an impact for him. We've also got some really practical examples of how curiosity has made a fundamental difference in the QI world from Imperial and various other organisations. Hopefully that will be able, that will help you build the case going forward.
So I think that's a really important point, and yes, we will be providing that. And again, coming back to the discussion we're having when you're talking about Northampton, Kate, and some other organisations which have done this, I was really struck by the work which Merck, a very large global pharmaceutical firm, have done around curiosity, where I think, and Kate, correct me if I get my the anecdote wrong, but they realised that curiosity was actually really key to their business, developing new products. And so established a whole team of curiosity advisors about how they could support the people across their organisation to be more curious.
Across their global operations. So they have a global curiosity faculty led by some of the leading lights in the academic investigation of it as well. And that they're kind of leaders globally. And then they have teams on the ground in all of their global sites with curiosity facilitators.
And we can give you the link to have a look at, which is, there's lots of fascinating things there. But again, based on very traditional focused business principles, they're not doing this because they like the sound of it and they like a good chat. But how do you best do it in a way which supports their business? Anna.
We've got a question from Adrian. Thank you, Adrian, who asks, are there any lessons we can learn from other sectors with regards to implementing curiosity, for example, education, or by mixing leaders across public services?
In terms of education, yes, loads and loads of lessons, and critically some really interesting ones at the leadership level as well. So we're talking quite a lot to some of our colleagues in education, and I had a great quote from somebody who said, well, of course we know how, of course we think about curiosity. That's what we do. We build curiosity in children and young people. We have got some brilliant input from a lady who runs an educational, a kind of outreach educational program for the UK Space Agency. Talked a lot about Tim Peake. And the approaches and the varying approaches that she takes to really not necessarily instill curiosity, but inspire curiosity in children and adults. This isn't just about education from a school's perspective, but lifelong learning. And when I asked, I wonder, how do you do that? And she said, it's about modelling the behaviour. and being curious myself and being passionate myself about the universe and space and these incredibly fantastic things, and about the raw science that goes with that, and then using innovative and different ways of imparting some of that. But again, we come back to that modelling of curious behaviour, and so yeah, enormous lessons from different sectors. One of the other ones that's cropped up as well has been curiosity in the context of retail and sales, and being curious about your customer and understanding. And actually, I think that translates quite nicely into being curious about your patient or your service user, and being more curious about them improving the treatment or the service that you provide. So yeah, lots of lessons. I'm not quite sure about mixing them at the top, but I think given the discussion we've had about leadership and its importance, it feels that there'd be some real benefits there.
Okay, thank you. We're entering the twilight zone of the webinar. We've got sort of just 3 or 4 minutes left. So any final questions you want to scribble in, please do. I was just going to build on that point. Okay, and do you want to say something about empathetic curiosity? This was certainly a new concept.
This is my new and something I will rant on about if you see me in the street.
But empathic curiosity, and particularly building on this point about how you learn across difference.
Yeah, so often we think about curiosity in the terms of the young child, frightfully exciting, but actually there's lots of types of curiosity, and empathic curiosity particularly is really important. It's about the best way to think about it is the desire to walk a mile in someone else's shoes, the desire to put yourself in their place and understand how they see the world from their perspective. And that as a concept of, as curiosity, and how we build some of the skills that you might need to, and thinking that you might need to be able to do that, is absolutely fascinating. But the outcomes that could be led to from increasing empathic curiosity, I think, are massive. Understanding how a patient experiences a patient journey, absolutely critical to understanding how you can then improve it and change it.
Okay, thank you very much indeed. So we are, Anna, last check-in. Any final questions to throw in?
No further ones to check in.
Excellent, thank you. Well, I think just to finish, to say thank you very much indeed, everyone, for joining, and particular thanks to Adrian for kicking us off so well, so practically. Kate, do you want to say something about next steps? If people have listened, think, interesting stuff, what do I do now? What do people do?
Well, if you have any other questions about the programme or about curiosity specifically, do feel free to email me, kate@kaleidoscope.healthcare, and I'll be delighted to answer any of those questions. If you would like to know more about how to get involved and look at the information pack and our not at all over the top video, have a look at collaborationfunder.org.uk/curiosity. The link is on your screen, and that will give you all of the information that we've discussed today, the slides that I went through, and also give you some additional information about Collaboration Funder and how it works.
Okay, thank you. And I've just realised I put the wrong web address there, so get rid of the .uk, collaborationfunder.org/curiosity. Although I'm curious about what you might find if you put in the UK, probably just a blank screen. But collaborationfunder.org/curiosity. Please do get in touch if you have further questions. Asking questions is what this is all about, so we'd love to hear from you. Thank you again for your time, and we hope to see you on a future Kaleidoscope webinar. So it's goodbye from me.
And goodbye from me.
And me.
There we go. Great. Goodbye from all of us. Lovely. Thank you very much. We will be recording this. It will be back on the Collaboration Funder website later today. Thanks very much. Goodbye.